17 years. That's how long it takes for clinically important research findings to make their way into widespread healthcare practice. 17 years. And for many findings, it doesn't happen at all. You could say that research is lost in translation. Ideas, discoveries with the potential of transforming lives remain buried in books and journals, never reaching the hands of the people who need them the most. This 17-year gap between practice and research, it's not just a statistic to me, but it's a source of professional and personal frustration. I'm a clinical scientist, and I work with some of the most vulnerable people in our society, older adults with severe dementia, such as Alzheimer's disease. The people I work with are not going to be around in 17 years to benefit from solutions that are available right now. As many as 80% of older adults with dementia suffer from pain. And for many, the pain goes under-recognized, under-detected, and under-treated. See, pain is subjective. You cannot measure pain in the same way as you measure blood pressure or temperature. You do not see a headache. Instead, we rely on the patient to tell us that they have pain, if it's getting better or if it's getting worse. But dementia compromises ability to speak, communicate, and process thoughts. Imagine being in pain and not being able to tell anyone about it. We hear stories from nurses of serious problems like fractures and abscessed teeth that go undetected for days, sometimes longer. And you know what happens when persistent pain goes undertreated in people with severe dementia? We see that these patients will start to develop challenging responsive behaviors that can sometimes include aggression. As you can imagine, this has implications not only for their own quality of life, but also for the care environment as a whole. And these types of challenging behaviors are often misattributed by staff to psychiatric causes, when in fact they're caused by pain. And consequently, many of these patients are treated with psychotropic rather than pain relief medication. And psychotropic medication in this frail elderly population hastens death because it increases the risk of falls and serious strokes. It doesn't have to be this way. Scientists, including our group, have developed better ways of recognizing and evaluating pain in this population. And these methods involve the systematic observation and recording of specific pain behaviors, such as certain grimaces of the face, certain body movements. When these behaviors occur together in a cluster, the presence of pain is very likely. And through a series of studies, we have demonstrated that when pain is assessed frequently and in this way, quality of care improves, quality of life improves, and even nursing staff feels less stressed on the job. Through surveys in 3 provinces, we have shown that frontline staff believe that these types of assessment procedures are important and should be implemented. But they're not being implemented in a wide scale, partly because of resource constraints. Sometimes there isn't enough staff. But other times, because of gaps on continuing healthcare education for frontline staff who may not always be aware of the most cutting-edge procedures of assessing pain in this population. Researchers in this and other areas have been trying to shrink this 17-year gap by trying to get their findings and discoveries out there, and they do that through seminars, webinars. They publish brochures, they distribute them as widely as they can. But how effective are these methods in changing clinical practices and patient outcomes? The answer is not very effective. Most often, following a webinar or a seminar, we don't see any clinical change, any clinical practice change, and any clinical patient outcomes. And the 17-year gap between research and practice attests to that. To change clinical practice, you need to do more than seminars and webinars. You need to increase public awareness and to change policy. In fact, to change policy, you often have to change public awareness first. This 17-year gap between practice and research, it's something that we as a society are can no longer afford to ignore. Because a tsunami is about to hit Canada and much of the Western world. Right now, 20% of the Canadian population are 65 years or older. In just 45 years, 1 in 4 Canadians will be over 65, 1 in 4. That aging of our population is going to bring with it an increase in the number of health conditions that often accompany aging, including dementia. In just 25 years, 1.7 million Canadians will be living with dementia. 12.7 million Americans will be living with dementia. Is our already strained healthcare system going to be able to address the increased demand without introducing innovations quickly as they occur and as they come about? The 17-year gap between research and practice is going to make that very challenging. When I was a young kid, I wanted to become a rock star. I wanted to be like Mick Jagger. And then I discovered that that wasn't going to be possible. And when I discovered that that wasn't going to be possible, I decided that I wanted to become like Christine Chambers. Christine Chambers is a professor of psychology and pediatrics at Dalhousie University. She has been a Canada Research Chair at that university, and she's an expert in pediatric pain management. She has 4 kids. And she often tells the story of her 4 kids when they were little and how she used to take them for various medical procedures to facilities affiliated with her own institution. And how disappointed she was when she discovered that the very procedures that she herself had helped develop were not being used in her own institution. She didn't know what else to do, because she was publishing like crazy. She has a lot of publications in academic journals. She didn't know what else to do. So she started to tweet. She started to tweet about pediatric pain and about how to manage it. And that's her hashtag she used, "It doesn't have to hurt." And some of her team began to tweet with her. And what happened several months later was actually remarkable, because her content on social media had accumulated 100 million impressions. 100 million. Try to do that with a webinar or a seminar. A short video that she had developed with information about pediatric pain management had acquired 150,000 views on YouTube. People were talking on social media about her content and about how they were going to change the way they do things, parents and clinicians. And after media picked up her story, another remarkable thing happened, and that was Christine was invited before the entirety of the Canadian Senate to talk about pediatric pain, and that's how close a clinical scientist can get. That's as close as they can get to potentially impacting policy in a way that can change people's lives. Christine's campaign inspired our own, and we launched our own campaign, the See Pain More Clearly campaign. Our goal was to tell the world about the problem of pain in dementia and potential solutions to manage that problem. First, it was just a research student of mine and I, and 2 telephones. That's it, 2 of us. We prepared a website with resources and information about the problem, and we also created a video script. We vetted the script by sharing it with potential knowledge users, such as clinicians, families, caregivers, and then we incorporated their feedback. On the International Day of Older Persons in 2019, we launched, again, 2 of us with 2 phones. And we chose the International Day of Older Persons because we wanted to capitalize on the momentum that the day offered to topics related to aging. 5 months later, we were thrilled to see that our tweets had accumulated 5.5 million impressions. Our short video had over 50,000 views on YouTube. People were posting about, we didn't know this, and we got to change the way we do things. Our website had been visited thousands of times in 55 countries. 10 media stories picked up the campaign and our work and talked about this problem. But perhaps more importantly, we counted the number of tweets about pain and dementia during our 5-month campaign period as compared to the 5 months in the previous year. This is just our, other people's tweets. We didn't count our tweets. Other people tweeting. We counted how many people were talking about pain and dementia during our 5 months versus the 5 months in the previous year. There were twice as many people on Twitter talking about pain and dementia during our campaign than the prior year. We had changed the conversation. But as exciting as that was, there was a downside. We quickly discovered that that wasn't going to be sustainable. 2 of us in our phones were spending several hours each day summarizing evidence-based content, making it engaging, sharing it, responding to posts. And we both had full-time obligations. We just couldn't sustain it. So we decided to take the next step. And we applied for funding from the Saskatchewan Health Research Foundation and the Saskatchewan Center of Patient-Oriented Research. And that funding allowed us to relaunch a bigger campaign, one that would go for a year, one that would expand from Twitter and YouTube to a variety of social media platforms, including Instagram, Facebook, and LinkedIn. The funding allowed us to create a bigger team that included not only clinicians and administrators, but also knowledge users, such as family members of people with dementia. Most importantly, the funding allowed us to create a digital media team that would actually manage the social media accounts. They prepared 4 videos for us, 1 minute each, summarizing the evidence-based content. And that made it feasible. And then we went for a year. This time we weren't surprised to see that our content had received millions of views. That included 47,000 engagements. That's people who are either retweeting or responding to our content. This time our website had been visited tens of thousands of times in 82 countries. The 4 information videos were viewed 250,000 times. Again, the feedback from knowledge users were remarkable, and the information was out there. Now, have we found a way of closing the 17-year gap between practice and research with social media? Well, I don't think that social media solves the problem completely. But by being able to reach millions of people and potentially interact with them relatively easily, we have positioned ourselves toward narrowing that 17-year gap and allowing more older adults with dementia to benefit from available solutions today, not in 17 years. As scientists, we have to keep our eyes open to new possibilities. And we ought to use modern tools. Rather than relying exclusively on books and journals where information might trickle down from one scientist to the next, we can use social media to get the knowledge out there, to disseminate it, and to inspire change. It is our hope that other researchers in this and other areas will take our lead and will use social media, again, rather than relying exclusively on journal publications. so that we can get the knowledge out there to the hands of the people who need it. Because when we do that, we create a society where science serves everyone, including the most vulnerable people among us. Thank you.